This is Dr. Efwalene again. This time I'm going to talk about wellness checks or annual checks or routine checks for women. As stated before, I'm an obstetrician gynecologist with more than 25 years experience in the field, having trained in Kolebu in Ghana and also in the United States. Okay, so why do women go for these routine or annual or wellness checks? These are visits you make when you feel perfectly well. You schedule them typically once a year. We go because this presents an opportunity for you to get advice and counseling on lifestyle changes or diseases which may be early in their course, and hence you get an opportunity to avert a more serious disease when it is diagnosed much later. For most women, the commonest reason why they go for these annual checks are pap smears, which detect cancer of the womb. I should say cancer of the cervix, which is only the mouth of the womb. It does not apply to any other female cancers at all, but this particular type. And also for breast examinations in a quest to diagnose breast cancer early. I do want you to know, however, that it presents an opportunity for many other interventions, such as diagnosing diabetes early, diagnosing thyroid disease early. This does tend to run in families, as does high blood pressure, which is very common in Ghana. High blood pressure, typically most people are not aware they have it and might have it for years unless they go somewhere and check their own blood pressure. This is very easily done at any physician visit and should be checked once a year so that if it gets abnormal, opportunities can be taken to control it. First, figure out why you have it, then control it. If it's early pre-cervical cancer change, you do not have cervical cancer yet, but there are changes on your cervix that, if left unchecked, will progress to cervix cancer. It can be treated, and then you have an opportunity to have this just be a slight inconvenience, but not a life-changing diagnosis. The same thing goes for mammograms as women get a little older. Mammograms help to detect breast cancer early before you can feel a lump, and then the opportunity for cure is so much higher. Let me take a second to talk about something that most people don't think about. Young women, once they are sexually active, should be tested for sexually transmitted diseases and treated properly. Quite often, they don't go in for any testing, they are not seeing anyone, they don't have a problem. And then, much later in life, when they are ready to start a family, they find they are having infertility problems because their tubes are blocked from previous infection that nobody screened for, nobody treated, and now it's creating a big problem. If women are screened yearly between the ages of, say, 18 and 26, that's one recommendation in the United States, then the opportunity to treat infections is taken and the risk of infertility down the line is lowered significantly. So that would be my advice to younger women. That is why they need an annual check. It's also an opportunity to discuss abnormal periods and safety issues like wearing your seat belt, or even if your body mass index, which is your weight to height ratio, is getting off the chart, it's a good opportunity for the physician to discuss lifestyle, exercise, dietary choices with you so that you can avoid getting worse and other conditions that come with being overweight or obese. So these are the reasons why annual checks are recommended for women, with emphasis on different diseases at different ages. This is Dr. Efwalene from Obaatan Women's Hospital in East Legon. Our number is 266 449 225. Thank you so much for your attention.